when we reached that point where we had to talk about a feeding tube, Ben's disorder had progressed such that it was a very complicated interwoven with all the other systems that were going on. So it wasn't easy to say, okay, here is the risk reward, if you will. It was how does it overlap with other things, and everything became very complicated. Not that it wasn't always, but it even more so.
It became more focused in that we had to make the decisions quickly and in close succession to one another. Whereas before, Ben's sort of progress through the disease would be he'd be plateau, then he'd go down, then you'd get on another plateau, then you'd go down, and you had these pauses of time, and those pauses were getting shorter and shorter and shorter. And that's why we had engaged Pat when we were trying to decide whether we were going to fuse his spine. And as Stuart said, we wanted to get all those doctors in the room to say, okay, if we fuse his spine, what's the impact on his GI tract and all the things that are making up Ben, and have the doctors be aware of the impact, the surgeon to be aware of the impact of the spinal surgery on his GI tract, on his thing. And I know they can kind of think about it, but when you sit down and you put a face on it and you have a full-on conversation, it's much different than sitting with a chart. And I think palliative care made that happen. And whether it impacted the doctors as much, it certainly made us more comfortable in our decision-making process, because we felt like we had explored the opportunities to their fullest and had an open dialogue as opposed to a directive.
I think we didn't get all of them in the room.
Well, close.
No.
Some on the phone.
But we got,
Yeah.
but we had I thought a very, a very thoughtful discussion of it. In less complicated situations, they're never less complicated, but when there is a question of increased risk from feeding by mouth, oftentimes the calculation needs to involve what is the pleasure or the comfort or the meaning. It is a very symbolic and profoundly meaningful caregiving task to feed. So thinking of the benefits of feeding by mouth and what the risk or the burden is of continuing it. For some families, sometimes the effort involved to feed, it can go on for an hour or 2 or 3, so that your entire day is feeding, and that's a calculation that's worth naming.
Yeah.
We talked about
and valuing. So I think the palliative care role, again, is not so much to be directive, but to say, well, here are some of the good questions that we should examine so that we can figure out together what makes the most sense.
I thought I also saw much of this is in hindsight, because in the moment we were very focused on Benjamin and the decisions we had to make for him. But as much as you helped us, palliative care helped our decision making and the way we approach things, I think you also forced the doctors to broaden their horizon beyond their discipline. You had a sort of a dual role. You were helping us as the decision makers, but you're also helping the providers understand what the whole patient was for them.
The chance for the GI doctor and the surgeon, the general surgeon who would place the G-tube, and the orthopedic doctor who would place the spinal fusion, to all come together and understand something larger than their piece, and to see that these all had an impact on Ben.